Support kids who need it or pay the people who help them. It's the impossible choice healthcare providers are being forced to make as they face brutal cuts to the NDIS. Their incomes will soon take a hit, but it's our most vulnerable who will really pay the price.
We're getting phone calls from parents worried about whether their supports are going to end.
Tens of thousands of professionals across the scheme are going to have to walk away from servicing hundreds of thousands of participants.
Little kids like Eli, big ones like Kai. It doesn't matter who you are or where you live. If you see a physio on the NDIS, you might not be in a week's time.
Physiotherapists aren't going to have the capacity to see these people because they just can't afford to keep their doors open.
It's not financially sustainable.
A little bit like a call to arms, allied health professionals have rallied in the face of a pay cut. They say won't just hurt them and their patients, but us all.
If physiotherapists can't see them as part of NDIA, they're going to have to go to hospital. They're going to turn up to ED with a lot of significant health problems.
Be more pressure on the education system, more pressure on the health system.
Physiotherapist and director at Treehouse Paediatrics, Ashley Land, says if she can't afford to see patients on the NDIS, who will?
We've committed to continuing to see and support the kids that we're already seeing, but we will be absorbing the cost and we'll be taking a loss. And I don't know how long that will be financially viable for us to do, but we don't want to. What do we say? What do we say to them?
The National Disability Insurance Scheme, or NDIS, is what funds and supports people with a disability, while the agency, the NDIA, manages the allocation of that funding. And its providers like Ashley, the NDIA is cracking down on, tightening the purse strings in its latest price review.
I need to pay my staff. That's what the choice is. Keep supporting the kids in rural areas, pay staff.
NDIS-funded physiotherapists say they haven't had a pay rise in 6 years, and now what they are paid is set to be slashed. Come July 1, physio's hourly rate will be cut by $10 and their travel allowance to see patients halved.
We're driving on country roads, we're using fleet cars, but if we weren't doing that, then these kids in rural areas wouldn't be seen by anybody.
Ashley is based in Bendigo, a 2-hour drive from Melbourne. She employs 21 staff. Many drive to see patients in Donald, Swan Hill, Castlemaine, Shepparton, Charlton and Maryborough. Patients like little Eli. Eli's had weekly physio for much of his life, and Mum Tegan quickly learned it had to be at home.
Eli ends up shutting down and going off to sleep, and we just don't get the stuff that we need out of that session, whereas when we have Ash come out home, he engages more and he gets a full session in.
But with the July 1 changes looming, driving to see a patient like Eli with all the overheads will cost Ashley's business too much.
We will run at a loss.
And it's heartbreaking for patients who've seen great growth outside 4 walls. Kai Lidgett lives with cerebral palsy. Because of regular physiotherapy, Kai can swim 10 metres on his own and get himself up out of bed unaided. And none of it would have been possible working in the confines of a clinic room.
I know if I hadn't been able to see my physio, I would be a lot less mobile and a lot less independent. For someone who doesn't have that, it's got to be really tough.
And the NDIS knows this approach works. In its own practice standards, it recommends providers see patients in their natural environments, like at home.
They're saying you need to meet these practice guidelines by seeing kids in the natural environments, but we're going to pay you nothing to do that.
Physiotherapist of 11 years, David Dinker, manages a large team of NDIS therapists. He hasn't taken a wage for himself in years.
This perception that we are raking it in and we are rorting the system and the taxpayer, it's not the case at all.
He says the NDIA has given providers just 20 days to figure out how and if they can survive under the new price guide.
Most people have done their financial planning, their budgeting for next year.
David's launched a web page to help unite the sector, while the Australian Physiotherapy Association started a petition to see the cuts reviewed and reversed.
Investing in physio in the short term is going to save the system money in the long term.
Association President Rick Dawson.
There was no indication from the government that they were prepared to cut our rates.
In a statement, the NDIA told ACurrentAffair.
These changes ensure NDIS participants, funded by Australian taxpayers, are not paying significantly higher rates for some services than those outside of the NDIS. It's not fair or acceptable that NDIS participants pay higher prices for supports. In some cases, NDIS price limits were higher than non-NDIS prices by up to 68%.
But Rick Dawson says that number is flawed and based off Medicare data.
We believe that the NDIA doesn't really understand the complexity of NDIS, and we think that the NDIA should really spend some more time understanding the care needs of these people.
We see every milestone, we support every difficult part of their lives.
Yeah, and those milestones are so important, and this is the problem with reining in costs while still providing such vital care.